Welcome, everyone, to this exploration of Hashimoto's thyroiditis, a condition that affects the thyroid gland and, surprisingly, has significant connections to the nervous system. We'll delve into what this disease is, what causes it, how it impacts the body, and what can be done to manage it. Hashimoto's thyroiditis, also known as chronic lymphocytic thyroiditis, is primarily an autoimmune disease. This means that the body's immune system mistakenly attacks its own thyroid gland. The exact triggers for this autoimmune response are not fully understood, but genetic predisposition plays a significant role. Individuals with a family history of autoimmune diseases, particularly thyroid disorders, are at a higher risk. Environmental factors, such as high iodine intake, infections like Yersinia enterocolytica, and even certain medications, may also contribute to its development. Essentially, it's a complex interplay of genes and environment that sets the stage for the immune system to turn against the thyroid. At the heart of Hashimoto's is a gradual destruction of thyroid tissue by the immune system. Immune cells, specifically lymphocytes and antibodies, infiltrate the thyroid gland. These antibodies, such as anti-thyroglobulin and anti-thyroid peroxidase antibodies, target thyroid cells, leading to inflammation and eventually cell death. Over time, this chronic inflammation impairs the thyroid's ability to produce thyroid hormones, primarily thyroxine at T4 and triiodothyronine at T3. As thyroid hormone production declines, the body enters a state of hypothyroidism, meaning there isn't enough thyroid hormone to meet the body's needs. This deficiency affects numerous bodily functions, including metabolism, energy levels, and even brain function. Hashimoto's thyroiditis is the most common cause of hypothyroidism in developed countries. It's estimated to affect about 5% of the population, with women being significantly more susceptible than men, approximately 7 times more likely. The disease can occur at any age, but it's most commonly diagnosed between the ages of 30 and 50. While prevalence varies geographically, genetic factors contribute to its higher occurrence in certain families and ethnic groups. Accurate prevalence is difficult to ascertain as many individuals may have subclinical hypothyroidism, remaining undiagnosed for years. The signs and symptoms of Hashimoto's thyroiditis can be subtle and develop gradually over time. In the early stages, some individuals may experience no symptoms at all. However, as the disease progresses and hypothyroidism develops, symptoms may become more noticeable. These can include fatigue, weight gain, constipation, dry skin, hair loss, muscle aches and weakness, sensitivity to cold, depression, and cognitive difficulties like memory problems and impaired concentration. Women may experience menstrual irregularities. In some cases, the thyroid gland may become enlarged, forming a goiter, which can cause a feeling of fullness in the throat. Because these symptoms are common to many conditions, Hashimoto's can sometimes be mistaken for other illnesses. Diagnosing Hashimoto's thyroiditis typically involves a combination of physical examination and blood tests. A doctor will feel the thyroid gland to check for enlargement or nodules. Blood tests are crucial to measure thyroid hormone levels, specifically T4 and TSH, a thyroid-stimulating hormone. In Hashimoto's, TH is usually elevated, indicating that the pituitary gland is trying to stimulate the thyroid to produce more hormone, while T4 levels may be low or normal depending on the stage of the disease. Importantly, the presence of anti-thyroglobulin and anti-thyroid peroxidase antibodies in the blood confirms the autoimmune nature of the condition. An ultrasound of the thyroid can also be used to visualize the gland and assess its structure. While there aren't specific subtypes of Hashimoto's thyroiditis, the disease can present with varying degrees of thyroid dysfunction, ranging from subclinical hypothyroidism to overt hypothyroidism. Subclinical hypothyroidism is characterized by elevated TSH levels with normal T4 levels, whereas overt hypothyroidism involves both elevated TSH and low T4 levels. Some individuals may experience a transient phase of hyperthyroidism at excess thyroid hormone early in the disease, known as hashitoxicosis, due to the destruction of thyroid cells and the release of stored hormones. However, this phase is usually followed by hypothyroidism. The primary goal of treatment for Hashimoto's thyroiditis is to restore normal thyroid hormone levels and alleviate symptoms. This is typically achieved through hormone replacement therapy with synthetic thyroxine at T4, usually in the form of levothyroxine. The medication is taken orally, usually once daily, and the dosage is adjusted based on regular blood tests to monitor TSH and T4 levels. It's crucial to take levothyroxine consistently as prescribed and on an empty stomach for optimal absorption. Regular monitoring by a healthcare professional is essential to ensure that the hormone levels are within the optimal range and to adjust the dosage as needed. In addition to hormone replacement, addressing any existing conditions and adopting a healthy lifestyle, including a balanced diet and regular exercise, can help manage symptoms and improve overall well-being. Currently, there is no known way to completely prevent Hashimoto's thyroiditis, given the complex interplay of genetic and environmental factors involved. However, certain lifestyle modifications and preventative measures can potentially reduce the risk or delay the onset of the disease. Ensuring adequate iodine intake through a balanced diet is important, but excessive iodine consumption should be avoided. Maintaining a healthy lifestyle, including stress management and a balanced diet rich in antioxidants and anti-inflammatory foods, may also support immune system function. If you have a family history of autoimmune thyroid disease, regular thyroid screenings can help detect the condition early, allowing for prompt intervention. The prognosis for individuals with Hashimoto's thyroiditis is generally good with proper treatment. With levothyroxine therapy, most people can effectively manage their symptoms and maintain a normal quality of life. However, lifelong monitoring and medication are usually required. Recent research has focused on understanding the specific genetic and environmental triggers for the disease, as well as exploring novel therapies that target the underlying autoimmune process. Some studies are investigating the potential role of immunomodulatory therapies and personalized medicine approaches in treating Hashimoto's. While these approaches are still in early stages of development, they hold promise for improving the long-term management of this condition. Additionally, research is ongoing to determine the impact of dietary factors, such as gluten and dairy, on thyroid function in individuals with Hashimoto's, although more evidence is needed to establish definitive recommendations.